Assalamualaikum and hi. So my name is Aisha Maria and I will be explaining about the problem identification. In this part, we have conducted an interview with a vocational training officer from College Kemahiran Tinggi Maraledang who had an experience in biomedical engineering field for about 20 years. Current problem in biomedical engineering field that we identify is a problem related to nuclear medicine. The objective for addressing challenges faced by biomedical imaging staff in nuclear medicine is firstly to enhance radiation safety by develop and implement protocols to minimize radiation exposure for both patient and staff. Secondly is to provide continuous training and education to keep staff updated on latest technology, imaging technique and also safety protocol. The third objective is to keep quality assurance to minimize error and optimizing diagnostic outcome. And last but not least is to improve patient communication for addressing concern and reducing anxiety. Next is about the problem related to nuclear medicine. So for the first problem is about the lack of natural radioactive material such as uranium and cesium. The second problem is related to the price of the nuclear medicine that is rising and getting more expensive nowadays. Next is about the worldwide nuclear medicine laws that are getting stricter nowadays. Last but not least is about the nuclear medicine is getting hard to access due to the technology nowadays that is getting more sophisticated.
Now let's discuss about the impact of the problem, starting with the impact to the patient's care. Risking the health of the patient on getting heavily dangerous disease such as cancer and tissue damage. Usually, this is happening because of overexposure of radiation material toward the patient body. Next, impact to the biomedical engineering field. Required high costs for the preparation of radiation material for imaging purpose. Despite of radiation materials starting to be rare and hardly to be found this day, people starting to take it as an advantage and sold the radiation material with unreasonable price, where it requires us to pay a really high cost to get it. Next, incur loss to the evolution of imaging devices that are more advanced in each age. Because of the biomedical imaging device this day can do their work much more efficient and precise than the old method, it will be just a waste of time for us to use the old method that requires us a lot of time in order to create a simple image of inner side of our body.
Hi, Assalamualaikum. I'm Muhammad Iskandar bin Maizunair. I will present to you about challenges associated with usage of nuclear medicine. Biomedical imaging staff in nuclear medicine encounter various challenges, including radiation safety concerns, maintaining equipment accuracy, interpreting complex scans, and adapting to evolving technology. These professionals also grapple with patient anxiety, relates to radioactive procedures, and strive to stay abreast of advancement in this rapidly evolving field, ensuring effective patient care while addressing the intricacies of nuclear medicine. So for the first challenges that we will face among the biomedical imaging staff is radiation exposure concerns. Managing and minimizing radiation exposure for both patients and staff is a constant challenge, requiring a strict adherence to safety protocols and ongoing training. And for the second one is complex interpretation. Analyzing and interpreting nuclear medicine images can be intricate, demanding advanced expertise to ensure accurate diagnosis and treatment planning. And for the next one is equipment maintenance, ensuring the proper functioning and calibration of sophisticated imaging equipment poses a challenge as any deviation can impact the accuracy of results. And for the fourth one is technological advancements. It's keeping pace with rapidly evolving technologies in nuclear medicine requires continuous training and adaptation to new imaging modalities and software. And for the last but not least is resource constraints. Limited resources, including funding and access to state-of-the-art equipment, may impair the ability to provide optimal nuclear medicine services.
Hi, my name is Hanisa, and today I will represent to you about the solution to our problem. I will cover 2 solutions and Izati will cover another 2 solutions. Solution 1. Our group has do some research that by increasing the production of original substance of nuclear medicine will overcome the first problem that occur. So, how to increase it? First, by invest in nuclear medicine infrastructure, governments, healthcare institutions, and research organizations can invest in the establishment and expansion of nuclear medicine facilities, including those equipped for isotope production and radiopharmaceutical synthesis. Second, collaborate with research institutions, for example, collaborate with universities, research institutions, and national laboratories that have capabilities for isotope production also can. And lastly, third is promote an education and training by train the healthcare professionals and technicians in nuclear medicine procedures to expand the workforce and expertise in this field. We move to the next slide for the second solution. There are some strategies that can help the rising cost of nuclear medicine. Okay, first, government and insurance involvement. This can play a significant role in negotiating and regulating the price of nuclear medicine procedures. Second, the collaboration and sharing. The healthcare facilities can collaborate and share resources such as equipment and radiopharmaceutical production facilities to reduce individual costs. And lastly, public awareness and advocacy. By raising public awareness about the importance of nuclear medicine and advocating for policies that support access to affordable healthcare can encourage change at the policy level. That's all. Thank you.
Worldwide nuclear medicine law should be loosened as a solution to the third problem. The solution can be happen when international cooperation between other countries exists. It will encourage collaboration and knowledge sharing among countries to harmonize nuclear medicine regulation and facilitate the exchange of medical isotopes. Is streamline licensing procedure. It will simplify and streamline the licensing process for medical professionals to minimize administration burdens and facilitate easy access to nuclear medicine. For this point, we use this ebook as reference. It is technological advancement. The country has to invest in research and development to advance nuclear technology that are inherently safer. Technological innovation can contribute to more flexible and effective regulator frameworks such as a small modular reactor. We move to the next solution, which is nuclear medicine is easily accessible. It is a solution to the last problem. To make the solution happen, collaboration and innovation have to exist. Continued collaboration between national laboratories, academia, and industry can drive advancement in nuclear medicine, leading to simplified and cost-effective technique for diagnosis and treatment. Next point is telemedicine and decentralized care. The shift towards telemedicine and decentralized care delivery models can enhance access to nuclear medicine. Remote reads and teleradiology enable patients in remote or unserved areas to receive timely and accurate diagnosis, while cloud-based solutions may advance visualization and cost-effective technologies. Developing technologies that can increase access to radionuclides and miniaturize the chemical process that involved in nuclear medicine production can make it more affordable and accessible. This is the article that we can relate at this point. By implementing this solution, nuclear medicines can become more easily accessible, leading to improved patient care and better health outcome.
Assalamualaikum and hi. My name is Izan and I'm going to continue the presentation about pros and cons of the solution for our problem. Let's see through the pros part first. First of all, it helps improve accessibility and potential affordability for patients. Next, for enhanced patient care, healthcare access for the patient could be improved for remote. Then, for promotion of innovation and research, means by encouragement of innovation and faster research and development. Lastly, we can reduce the time to diagnose the disease by advancement in medical science. Talking about the pros, there will always be some cons out that needs to be considered with a safety concern. This thing might happen when handling the radioactive materials. Next resources strain will happen when a material shortage is gone and we need to wait for another one. So this takes a longer time. Last, regulatory and quality control bring a meaning to challenges related to quality control caused by overuse or misuse of the material. Now, let's talk about our last topic, which is conclusion. Nuclear medicine field in our country were considered less sophisticated. This field is still lacking in a lot of areas but can still be improvised by improving the reliability of nuclear medicine procedures. This can lead to better diagnosis and treatment outcomes for our patients. That is all from us. Thank you for listening.